So paleo is a complex set of what this diet really is. It's based on the work of Boyd Eaton and Mel Connor, who looked at what people ate in the Paleolithic times. However, that diet has been grossly misinterpreted to be very heavily laden with lots of meat, things like lard, saturated fats, and unfortunately it tends toward a lower or non-inclusion of very important foods like whole grains and legumes, which are almost entirely vilified by the paleo community. Now, the paleo diet can have some tremendous advantages to it. So I want to explore those with you, but also talk about the disadvantages. And I consider this paleo diet for women to be much more of something you do for 6 to 8 weeks, or you do it what I call paleo light, or sort of a modified ancestral diet. Paleo is sometimes called ancestral diet, modified, leaning more toward a Mediterranean direction. So it still kind of brings you back to the Mediterranean diet if we're pretty honest with ourselves about it. But let's look at some of the advantages, and then we'll look at some of the disadvantages. So the advantages of a paleo diet are that high protein intake and high fat intake, in modest to an extent, can be good for blood sugar balance. So for someone who's often low blood sugar, adding in more protein and even in animal forms can make a huge difference. If you're getting high fiber from plants, that can be a very absorbable source of fiber without any of the carbohydrate load that you get from grains. And a lower carbohydrate load may reduce glycemic load. However, there's controversy around that. In fact, Garth Davis's book, Garth is an MD who is a gastroenterologist, has actually found studies that clearly demonstrate that high meat consumption and low consumption of grain and legumes can actually lead to more risk of diabetes and metabolic syndrome. If you're getting a lot of monounsaturated and polyunsaturated fats and good fish oil in the diet, you can get a really nice balance of good quality fat. And the biggest advantage is that most people who go paleo are getting better fast initially because they've removed all the processed food, all the junk and all the empty carbs out of their diet. The cons are that this way of eating, if not done more toward a Mediterranean style, has an enormous carbon footprint, and that's one of the things that Boyd Eaton really talked about. This is not sustainable. It also is a very heavy acid-producing diet, which can cause inflammation and cellular changes that can be actually cancer-promoting. There's controversy around this in the paleo community. It's fairly unequivocal, looking at all the studies, blue zone studies, studies on the Adventists, that a vegetarian diet is the least likely to cause cancer. This high protein diet has been associated with kidney stones, high blood pressure, and even increased risk of certain inflammatory conditions like asthma. The high protein and low carb diets can really lead to some imbalances in cortisol as well because of that complete lack of absence of carbs. So for women, it can be problematic over time, and over time meaning even just a few months. A lot of people, and I see this in my food journals, in my patients all the time, go paleo and basically eat meat and protein and don't get enough veggies. It can be really helpful for people with leaky gut, IBS, IBD, blood sugar problems for a time to bring things into balance. But it's incredibly important to make sure that the diet is supplemented with ample amounts of vegetables, not an emphasis on the saturated fats, and making sure that we're bringing in other elements in the diet that have been shown to be found to be healthy, like some amount of grain and some amount of carb, in my opinion.